All right. Well, welcome back to another episode of Brosides with the Vedalas. And today we're going to talk about a really interesting new finding or new name change, which is essentially the change of polycystic ovarian syndrome or PCOS to an official new name known as PMOS, which is polyendocrine metabolic ovarian syndrome. Now, there's a lot of hope with this new change of the name that they would be a better fit overall to help patients understand what exactly this specific chronic illness is composed of and what are some of the issues that patients are going to have to deal with throughout their lives. So, Veer, what do you think about this name change of PCOS to PMOS?
I think it's a good change, man. I mean, so I was an article came in like what May, I think, just this month in 2026, and in the Lancet, and I think the main things are the diagnostic criteria didn't change. It's just like a renaming, not like a redefining thing. But I think in broader view, the term PCOS makes it seems like it's only an ovarian problem. And when reality, it is truly a metabolic issue, right? So when you look at the diagnostic criteria, which is the Rotterdam criteria, been around for a long time, it's threefold. There's the clinical science of hyperandrogenism, which is the hirsutism, the androgenic alopecia. We sometimes get a testosterone level to see if it's elevated. And then you've got the ovulatory dysfunction that follows. So then you have your oligomenorrhea, which is like you've had periods before, but now you're skipping months, or you have amenorrhea where you're not having periods altogether. And then there's the polycystic ovaries on ultrasound, but you don't have to have polycystic ovaries to diagnose polycystic ovarian syndrome, which is why the diagnosis name doesn't make as much sense. And when you think about the treatment aspects, we're telling them to work on insulin resistance, weight loss, start metformin, talk about the hyperandrogen causes and putting on spironolactone, and these types of things that we're actually looking at are combating the hormonal imbalances in reality. And whenever we're looking at PCOS, we have to rule out hormonal abnormalities like thyroid dysfunction, high prolactin, we think about Cushing's sometimes, right? And so, or androgen secreting tumors. So the whole the whole PMOS, which is that polyendocrine metabolic ovarian syndrome, I think actually makes more sense than just PCOS, just focusing on the ovarian aspect. I think there's something really interesting though, kind of like how like we talk about the term obesity has kind of a negative context now, where
Hmm.
it can be kind of triggering, or we're trying to use people first language or bias-free language. I think PCOS sometimes has that same kind of context.
Yeah,
Would you
yeah.
agree?
No, I definitely do. And I think the focus is a shift away from just fertility issues to also looking at the other metabolic aspects of this illness. Specifically, we've already mentioned a few, the hyper or the insulin resistance, the hypertension, and also some of the other concerns and risks for type 2 diabetes. So I definitely do think this is a positive change. I'm just curious if this is going to change in any ways down the road, the treatment of it. Will it still be the same? Are we now gonna focus more on perhaps maybe getting GLP-1s approved for PMOS? I mean, that's really where
That's
I
the
was
hope.
thinking could be the
That's the
case.
dream. Yeah. I mean, if you think about PCOS, what are you doing for the ovaries that have cysts?
Removing the cysts?
I mean, if they're a complex cyst, I guess, but otherwise we just watch.
That's true, yeah, we just leave 'em. Yeah.
So we're treating it like it's a metabolic disorder either way. Like, hey, focus on weight loss, get healthy exercise.
Mhm.
You know, medications like metformin. I mean, it's I think it's about time that
Yeah.
I think it's well received. I think people. I mean, I've been hearing posts about it and seeing videos about it and reels about it everywhere. I think people are
Mhm.
receiving it well,
Uh-huh.
and I think over time it'll be it'll be it'll take time to kind of get into the medical realms and everyone to start using it. But I think it starts with us as providers first and educating our patients. But these days, I feel like a lot of patients are coming in knowing a lot of this stuff because the internet is everywhere. So
Definitely,
it's coming for you, my friends.
and
PMOS is going to be a
and
thing.
And I do think AI, specifically ChatGPT, and if people have access to open evidence, I do think that plays a big role. But I think it's a good thing overall. It's keeping us up to task as physicians and also as other providers. But also at the end of the day, it's good for the patients because hopefully that's less time we have to spend on educating is the way that I see it, given just the amount of restricted time that we physicians tend to have to see patients. But I really am interested to see if this is actually going to be the beginning of perhaps insurance coverage for GLP-1, because I think that really would be a significant step in the right direction. I do
Yeah.
think GLP-1s have a lot of benefit for women with PMOS, and I also do think that we have seen anecdotally evidence that patients that do have PMOS tend to do better when it comes to their decreasing insulin resistance, weight loss, and decreasing their risk of diabetes, and we've also seen fertility, increase in fertility chances with
Yeah. Yeah,
patients on
absolutely.
GLP-1s.
Absolutely. And I think, a lot of patients don't have to, but patients who have diagnosis of PMOS or have met Rotterdam criteria, some of them will actually meet criteria of metabolic syndrome, right?
Mhm. Yeah.
You get a lipid panel and their cholesterol is high, their waist circumference is elevated, they're pre-diabetic, And I think this will be, I don't know if it'll be like an individual FDA approved diagnosis, kind of like how diabetes and obesity and MASH are diagnosed. I don't think it'll be an individual one, but I
Mhm.
think it'll count as one of the comorbidities specifically for patients who are like BMI of 27 or something and they have PCOS. It'll be definitely included as a comorbidity to meet criteria for GLPs.
Hmm.
At least, whenever I prescribe, I always put in my note, "Hey, these are the comorbidities. Also,
Yeah.
this is all the things that patient can improve from." I think PCOS will be a big one. I think hopefully, or PMOS. I apologize.
PMS. Yeah, PMS,
Yeah,
PMOS. Why do you
yeah.
think that, what it took so long to really, because we all knew all the different aspects that, this particular illness has. Why do you think it took so long to make this name change?
I think it takes time for consensus to occur and people to all come together and agree.
Hmm.
In my thought process, you know? If you think about, like, how I wonder how in this Lancet review, they mentioned how many people how they came to this process, and they all mentioned, like, names that they were concerning or considering, and, cystic was one that wasn't included, but polyendocrine, metabolic, and ovarian were, like, the highest ones that were supported, and then when they put that out in the general public and did, like, what, like, evaluations with patients and see their thoughts. The patients also agreed, so it's like a multi stakeholder type of situation, and some of that stuff might take time. For example, like dietary guidelines come out every 5 years. Why do we do that? Get people together and do research and get a consensus, and at least that's my thought process.
Mhm. I think necessary change, it's gonna have a lot of benefits, it's gonna do a lot of good for patients. I'm wondering if it's really the beginning of a new phase where we are going to start maybe looking at things differently. Like, for example, when you're looking at Alzheimer's and the terminology is kind of already there about type 3 diabetes, right? I think that could be something that, if that were to happen, that could be a really interesting change. But I think this renaming a PCOS into PMOS could be the beginning of a new phase where we are finally addressing them for what they are instead of
Yeah,
still using
yeah,
outdated terminology.
yeah, and I hope it sticks. For a while they were trying to rename obesity ABSIDI. You remember that
Yeah.
ABCD?
Yep. Mhm.
Adiposity-based chronic disease, and I don't think that caught along. So I think PMO as well. I think it's got a lot of presence and it's more accurate, and so it's something that we'll have to include. And ICD-10 codes will change, and we'll start putting it in our notes, and then it'll be a
Yeah.
regular thing, kind of like Mash,
Yep.
right?
Yep. Well,
Or with
this
an
was
alcoholic.
again, a very interesting discussion that we just had. And so that's what it is. It's PCOS is now going to be officially called PMOS. And there's going to be a lot of good changes that'll come with it and some questions that remain. But hopefully this was a much needed change and looking forward to the benefits of this particular name change. Once again, Veer, thank you so much. Really appreciate it.
Thanks,
And
sir. People listening, comment on us and comment below on our channels and let us know what topics you want us to hit for Brosides.
absolutely. And thank you so much for those of you listening to Brosides with the Vedalas. And we'll see you again next week.